So we try our best to save the vitality, but sometimes the bacteria irritates and inflame the pulp tissues. So not the restoration failed, I would rather say the tooth failed.
Right.
Can you hear
That's
me?
great. That's great. Yeah, we can hear you.
So and
Yeah.
always we must explain to the patient when they come to us, they didn't bring a vital tooth or 100% perfect tooth. It's already like how to say infected with what caries. So we try our best to save the vitality. For my experience, there are about, I would say, 90% is success rate and 10% is the failure rate, where I know the tooth, like I kind of overdo it lah. Okay, so I'll
Understood.
start with my topic today. So first, always don't try to be perfect. So whenever you try to be perfect, it always lead to frustration. So just try to be better than you were yesterday. And as Kathleen mentioned just now, uh, taking what photographies of your own works, they are your how to say teachers of your own mistakes. So next, I'm going to talk about adhesive, mainly on adhesive, immediate dentin sealing, and resin coating. So what are the importance on these lah? So first, I talk about adhesive. Am I talking too fast?
No, Dr. Navin, you're well paced. Really good.
Okay, thank you. So we always must know our bonding strategy. Okay, for enamel is always micromechanical. So you always have to etch your enamel no matter what. But when it comes to your dentin can be micromechanical or chemical. So the adhesive application always depends on your adhesive strategy. So how do you select your strategy? And before I go into like how to say the strategies, I always was how to say think like it's already named as dentin bonding agent, but like why they taught us in how to say in schools that dentin don't really bond well. It's just like how to say the bond strength is like how Kathleen mentioned, enamel 30 megapascal, and we can achieve 50 megapascal by using those standard adhesives. So next, when we come to should we etch our dentin? So normally when I was in government last time, when I asked my seniors, they will say like if it's deep cavity, you don't etch the dentin, just do selective etching. If it's not deep, then you can do total etch. So finally, after all this while, what I got was it always depends on what kind of bonding agent you are using. So if you imagine if you're using the fourth generation, which is Optibond FL, a gold standard, it always comes as a 3-step, as Pascal Magne says, as a 4-step. So first you etch your enamel, then after that you etch your dentin, then after that you prime, then you bond. Then next they try to simplify it to 2 bottle system, but their bond strength wasn't so great. And with the etch and rinse, they also encountered post-op sensitivity. That's where they developed self-etch bonding agent. So it comes in a self-etching primer for your dentin. No matter how you using your self-etch, you have to etch your dentin. You have to etch your enamel, but don't etch your dentin. Later I'll tell you why. Then after that comes the second bottle is an adhesive bonding resin, and they try to simplify it to 1 step. Then finally they come to universal, where you can use it as total etch as well as your self-etch mode. So next, if you see here, you can see my arrow, right?
Yeah, we can see it.
Okay, thank you. So this will be Optibond FL, which is I use in my office. It's a 4th generation bonding agent, and this will be SE Curare, 6th generation self-etch mode, and this will be 2 universals that I would recommend, or if I'm using a universal, I would prefer this both. So next we come to Dr. Biomimetic. He's like how to say, I would say he dedicated his life for doing research for adhesive. So what he mentioned here, as always remember, primer is always hydrophilic, which likes water, and adhesive is hydrophobic, which hates water. So when you join these two in a single bottle, so you will be compromising a lot. So if you see, as this combined primer or adhesive resin solution have a higher solvent to monomer ratio, which is going to cause your hybrid layer to be too thin. So that's why you have to, like, how to say that when you're using a single bottle adhesive, it's recommended for you to apply multiple layers. Means you apply first layer, air blow it. If you're using universal alone, because you contain solvent in, so you air blow, evaporate the solvent, reapply back. So basically, even though if you're using a universal bottle, you are kind of like, it's still three step, because you have to prime as long as possible lah, minimum 20 seconds. And always remember, after you prime your tooth, your dentin should appear glossy. It shouldn't be appear dry. If it appears dry, means you either over etch it or didn't prime enough. So you prime longer. So this will be a picture where you see after I sandblasted, I haven't etched the tooth yet. After I etch and I prime, you will get that glossy appearance, and you can see the how to say the rough marking on the dentin. Like me, I use diamond burst for my cavity preps, because I'm using a total etch technique, Optibond FL. So next, why I would recommend is both universals, because they contain 10 MDP monomer, which is a potent monomer in SE curare, which it has a chemical interaction between the how to say calcium, which present in the dentinal tubules. So it binds and how to say have a chemical bond to the tooth. So next we come to see the how does a total etch works. So if you see, every time when you prep, if you prep using a diamond burr, you will create a thicker smear layer. But when I'm using a total etch technique, it's not a issue for me, the smear layer. So why I use like how to say diamond burst, like how to say you create like a kind of like undercuts for a better addition, because your bonding strategy here is going to be micromechanical. So when you etch your dentin, at the same time you are going to demineralize your dentinal tubules as well. And how to say, the longer you etch, the deeper you're going to demineralize. That's where the problem comes. So how sure you are going to prime your dentin till the end of the how to say demineralization area. So that's why you don't etch your dentin not more than 15 seconds. But if you're using universal, I would recommend don't etch more than 10 seconds. Then after that, you will apply primer to rehydrate back all these exposed to collagen tubules. Then after that, you're going to apply your adhesive on top. So when it comes to your how to say self-etch mode, I would recommend, if you're using like how to say, if you're using a diamond burst, then finally you just run through with a fine diamond burr to reduce your smear layer. Or not, you can also use a carbide burr to reduce your smear layer. And you are going to apply how to say primer here. So primer is going to dissolve your smear layer here. And you're going to like how to say, there's going to be a bit of a chemical interaction of 10 MDP to your how to say calcium present in your how to say in your dentinal tubules. Then after that, you're going to place how to say your adhesive. So you'll be having a micro retention here, and you'll be having a chemical bond here. So like how to say, that's why we would advocate like you sandblast your dentin if you're using a self-etch mode. So by sandblasting, you're just removing all the smear layer, but your smear layer in the dentinal plugs will always be remain there, which that's the main point, like how to say, doesn't really cause your post-op sensitivity, and you have a better chemical bond to your dentin, as well as your you have a mechanical retention. So if you're using, like for me, if I use total etch technique, so by sandblasting, it doesn't really affect my bond strength, but I make sure I sandblast so that I bond to a clean enamel and a clean tooth structure. And it's remove plug biofilm, and plug biofilm also can lead to failure of restoration, and it also improves micromechanical retention, especially on your enamel. So that's on the bond system.
So sorry, Dr. Navin, if you don't mind me interrupting. So
Yeah, sure.
Is there a correct way to use this sandblaster?
Sandblaster, I'm using Aquacare with a pressure of 4 bars, and it's always depends on what type of how to say sandblast you are using, and you can follow the manufacturer's instruction.
is there anything like over sandblasting? Is there such a thing? Let's say, I know most textbooks most articles I've read recommends sandblasting for 5 seconds. What happens if I sandblast for 10 seconds by accident? Is there anything that I should be worried about?
High chances you'll be removing more dentin lah. So if you're already very close to your pulp, so be careful when you sandblast the area close to pulp, which can expose your pulp there lah. So after you sandblast, then you realize shit, it's bleeding. So when it's bleeding, then it comes to like mainly like address your pulp first, not your bonding lah. So normally I'll be using how to say, sodium hypochlorite to achieve hemostasis. Then I use MTA or biodentin to close that. Then after that only I start my adhesive protocol. And there are a few cases like how to say very minor pulp exposure, and I bond it over it, and 3 years plus is still going good. My friend's mother lah. But like how to say, it's still it's your own choice lah. You no matter what you hear on this webinar, you have to go back, do your homework, study, and see what works best in your hand. But I personally, nowadays if I got pulp exposure, I rather direct pulp cap it. Then only I do bonding over it.
All right. Thank you so much, Dr. Navin, for answering.
So next come to immediate dentin sealing. So when first I know immediate dentin sealing, I was like, oh my god, so simple. It's a step in how to say our direct composite. So but like immediate dentin sealing mainly they be termed for any indirect restorations. So what is immediate dentin sealing? So it is a very good paper by Dr. Pascal Manet. So it's available in online free. So can download and read on it. So it's just like how to say you sealing your freshly cut dentin with your adhesive strategies. Either, but it must be done before your preparation so that it doesn't really disturbs in your seating of your prosthetic during your issue. So how do you do it if you are using a self-etch mode? So you sandblast your freshly cut dentin for 5 to 10 seconds depending upon what type of sandblast you are using. Rubber dam isolation always. Application of your primer. So you gently agitate or scrub over your dentin. So always remember dentin sealing is just for dentin. So you scrub your dentin, you prime nicely at least for 10 to 20 seconds. The longer the better. Air dry it because normally primer comes with solvent. So you air dry it. Then after that you apply your adhesive over the tooth. Then try to avoid air blowing during your adhesive application, because if you're blowing air, one, you're incorporating thicker oxygen inhibition layer. Number two, you are leading to not a uniform hybrid layer. So when you air blow, certain part will be thin, certain part will be thick, and cure for 20 seconds. So next, when it comes to total etch technique, so normally I etch my dentin up to 10 seconds lah. So first I apply my a bit of etchant on the enamel alone. Then after that I etch my dentin. Then later, because anyhow I'm going to re-prep back my enamel one, so I'll just make sure that enamel. Then after that I re-prep, so it be sufficient for me to get the the shape I want to. And always when it comes to total etch, right, it's always like you either over drying or it's over wet. And according to the paper just now I mentioned, quoted, Dr. Pascal Manet, he always advised like either you use your 3-way syringe, don't directly blow on the tooth. Either you can blow from side of the tooth or not. Normally what I do, I just take the a small high wet suction tip and just run along the tooth, but try not to touch the tooth lah. So by that it creates a negative pressure, and when you prime you and make sure that it shines, it be glossy, the surface. Then after that you're going to apply your adhesive, and always avoid blowing your adhesive, and wick away by normally I'll just always have a pulp free tissue in my hand, I use the same brush, I wipe it, I just dab it, I just wipe it, dab it until I see a uniform layer and cure for 20 seconds. So when it comes
So,
to
sorry, just to reconfirm. So you
yeah,
are dabbing the cavity with tissue paper
not that
to wiggle.
not
Is that?
the I'm so sorry. I'll be using the micro brush, so I'll be
Ah,
dabbing the micro brush.
okay, okay, all right. Thanks.
Ah,
Thanks so much for clarifying that.
no worries. So when it comes to universal bonding agent, it's always you must how to say you must see the monomers also inside the bonding agent. So like Optibond universal, their how to say main monomer is will be GPDM, which is like a main monomer in Optibond FL for total dash technique. And if your universal contains 10 NDP, then I would highly recommend for you to use as a self-etch mode. So, and it always depends on what type of bonding agent you're using and the monomers inside. So you always can Google and read and find some articles how that specific monomers act towards dentine as a self-etch mode, or is it better on a total etch mode. And okay, so another step that you should add when you are using a universal or any SA bond, you have to apply a thin layer of flowable composite, about 0.5 mm on the dentine. So that's what we call as resin coat. So later I will explain why we need to do the resin coat. So the advantages of doing ideas is like number one, we are preventing from bacterial leakage. Once our dentine is exposed, there are tubules that the connection towards your pulp. So bacteria can travel there. So enamel is like how to say like a barrier. So protects your dentine. So and delayed dentin sealing, which means like you are doing IDS during your issue of your crown, it's already you're doing on a contaminated dentin, which already proven it brings a very low bond strength. So next, like how to say, by creating a hybrid layer, it actually mimics your DEJ. So that's why, like how to say, gold standard bonding agents, we will be getting about 50 to 55 megapascals, which is similar to the DEJ strength. So that's what we try to replicate. So that's why we need to get a very clear dentine with a very good peripheral seal zone. So it's seal tight your bacteria inside. So next, like how to say, by using a layer of low viscosity resin liner, which means your global composite. So what all you can see after you do all these procedures, number one, for sure, not for sure, about 95%, some of them, they might feel slight sensitive because the composite layer is still thin. And if the depth of the cavity is too deep, then possibility for them have slight sensitivity is normal. And it reduces your post-op sensitivity. Creating a hybrid layer before taking an impression causes a better fit of your restoration, and it helps to optimize your bond strength on your dentine, which increase your bond strength 400% than a regular strength. So next, coming to resin coat. So what is resin coat? Resin coat is very basic. So we are applying flowable composite over only on the dentine. So what happens if you apply on your enamel? Always remember, flowable composite has a very less filler content, which tendency for it to break. So that's why we try to avoid it to bond to the enamel. So if what happens if you when you're applying resin coat, it touches your enamel, either you can re-prep after your IDS, but no matter how, you have to re-prep your enamel before you're taking an impression, to make sure there's no any flowable resin coating or any of your bonding agent there. And yeah, and what you can do, you can actually use like how to say a microbrush and just slightly wick away from there to reduce the amount of the flowable there. So later when you want to re-prep your dentine, it'll be very much easier and you don't need to over prep your enamel. So next, why do we do how to say uh, resin coat? So number one is always it acts as an elastic buffer or stress breaker. So because of the less filler content, it actually absorbs pressure from your firm restoration. For example, you are applying Emax on top. So Emax is very firm, and the strength of Emax and enamel are more or less same. So this resin coat will be acting like a DEJ for you to absorb stress. Next, it increases your hybrid layer thickness. If you're using universals or any SE, any Surface, any other any other bonding agent other than Optibond FL, doing resin coat is very very important. But why not Optibond FL? Because Optibond FL's adhesive is highly filled. So where you'll be getting about 80 micron of hybrid layer. Other than that, you'll be getting about, if you're using universal, you'll be getting about 2 to 4 micron layers. What happens after that? Your oxygen inhibition layer can be thick up to 40 microns, which lead to your bonding agent is not polymerized. So by adding about 0.5 mm, how to say, um, flowable composite, it actually polymerizes your hybrid layer. That's the importance of using how to say resin coating, especially when you're using universals. And it also creates a weak interface between your flowable and your packable composite, because both of them having a different filler particles. So by that, if any excessive force or any failure going to happen, it happens above your how to say resin coating. So your IDS layer is always remaining intact. It doesn't really expose your dentin. So when patient comes back, you just sandblast and just rebuild back. So it creates a very easy repairability process. And so in this paper, they have done how to say uh, IDS and resin coating and testing the strength. So here I just going to focus more on Optibond FL, Clearfield SC Curare, and SBU, the how to say the 3M orange porter. So when you see when they did delayed, DDS stands for delayed dentin sealing, the bond strength was very poor for all these three. So when they do IDS alone, if you see Optibond FLs gives you about 54 megapascal, but for SE and for SBU, you'll be getting about 17 and 15. And when they did IDS with resin coating, as what I said, Optibond FL's adhesive is highly filled. So it doesn't really affect, but I do my, how to say, um, resin coating for other advantages. It acts as a how to say elastic buffer. It creates a fail-safe zone. But when you see for SC Clearfield and your universal, the bond strength nearly doubles the amount. So that's how to say it improves your bond strength. So next, I'm just going to share a few of my cases. So first, I go with direct case. So patient came to me, how to say, the previous dentist tried to do a minimally invasive approach, but failed to do so, and they just how to say close the space with some temporary material. And my advice, like for me also, right, if I feel it's very hard for me to go and approach and do a very good restoration, perfectly sealed restoration, I would rather go aggressively slightly, so that I can get a better seal and a better longevity. So in this case, what I did, because of how to say the temporary is there, so I just remove the temporary and break the contact point. Then after that, I place the rubber dam, and always, like how to say, before I prep, I always place the wedge. If you see, the wedge will push your gum deeper, and tendency for you to tear your dam is way more lesser. Once I get how to say my peripheral seal zone, I will be placing two metrics side to side, so that I can control the volume of the and the shape of the tooth, and I'll rebuild one first. So why I rebuild one first? Number one, your matrix band always have a thickness, so we try to avoid how to say um, uh, open contact in between your both tooth. And I also be using Garrison clamp, which actually separates slightly your tooth, which compensate your matrix thickness. But if in case you don't have all these things, you can also use a wooden wedge. You wedge it quite tightly. It actually opens a bit of contact to compensate your how to say contact. How to say compensate your thickness of your matrix band. And if in case patient complains is too how to say tight or what, you just run your how to say your polishing strip interdentally, but you wedge it with a wooden wedge. So you open back the contact, so it'll be easier for you or proximal how to say strip to go in, and you can just like slightly adjust it so patient will feel comfortable. And the advantage you building one, after that another one, so that you can polish the proximal side nicely. So next comes to an indirect case. So this patient came to me with a complaint of pain and on biting. So when I did how to say sensitivity test or cold test to respond normal, I took a PA looks normal, and with this, with normally, right, if amalgam more than 5 years, you should suspect caries inside. And from here, I can see there's a how to say there's a composite filling over here, which may be because of crack. The other dentists, they just did a composite filling here, and in this picture is not very visible that there's another crack here, peripheral rim fracture. That's what we call that, over the mesial margin. And but the patient said like try to do my option here, just to like how to say just do a cuspal coverage after removing your crack, and we will reassess back. And I try to be as a how to say conservative approach. So once I remove the amalgam, you can see there's a horizontal crack going underneath the cusp, and in this picture you can visualize the crack here even better, and there's vertical crack going underneath this composite filling as well. So when I know I'm going to how to say there's crack underneath the cusp, I straight away did a 2 mm occlusal reduction. So I'll be using a depth gauge burr, which is measures with 2 mm. So from the center, in these kind of cases, I just from the center I just reduce so that I get a sufficient thickness of my Emax. Then I start to chase the how to say crack by not exposing the pulp. So it's a how to say a very important step to maintain vitality in your cracked tooth, which improves the longevity of the tooth. After I removed my crack, I did my how to say IDS, then resin coating, then I placed a piece of ribbon there, then I covered it with composite. So make sure that how to say the piece of ribbon, try to cover it, don't let it to expose to the external environment because it can absorb moisture. So this is on the day of my issue, my second sitting. So during this time, you can see like slightly wear on the how to say on the occlusal surface, and you can see slightly the ribbons start to expose, but it's okay. Then after I sandblast, you can see the ribbon even clearly. But it happens, we try to avoid it, but if it happens, it's okay. Then I issued the overlay, and patient is symptom free till now. He comes every 6 months once for review and for scaling. And my protocol for my Emax is always I'll be using hydrofluoric acid for 60 seconds. I wash it, so you'll be getting this frosty white appearance. It's a salt precipitate formed by this hydrofluoric acid. So I normally do 60 seconds of phosphoric acid and 2 minutes of ultrasonic cleaning. So what we are looking for is this kind of matte how to say surface which is ready for you to bond. So take home message is always document your cases. You are documenting your cases not to show off in IG or what. It's for your how to say for your own good and for your own how to say reference. At least you can see from where you start, and you can also see where's the mistake. And always how to say learn your adhesive strategy. What are you going to use, the total edge technique or self edge technique? Next will be immediate and sealing, and finally will be resin coating. Thank you very much, guys, and thank you, Janti, for inviting me.
Thank you so much for the presentation, Dr. Navin. Again, before I let you go, could I just trouble you to explain just one more concept for us today?
Yeah, sure.
So, can you give us a very brief explanation? What is decoupling with time? Could you just tell the participants what that actually means?
To be very this thing, just imagine there's a wall here, there's your enamel. there's grass here, that's your dentin. Okay, so you're bonding to your enamel faster by your bonding to your how to say grass, which is imagine is your tubules, which is fragile. Okay, so very for by decoupling with time, first when you cure for 20 seconds, the initial polymerization takes place. So it start to like how to say holds your dentin firmly. So by waiting 90 seconds, so the but how to say bonding agent still like it has monomers inside. So it need to be how to say when it cure, it start to become polymers, oligomers, right? So you want that polymerization to happen to reduce your stress. So that's why we wait for 5 minutes. So 90% of your stress be reduced. So if you wait for 2 weeks, 100% of your stress be reduced there.
Okay. If you answered it, but just correct me if I'm wrong. Just to summarize that, the reason why we wait for 5 minutes before we cure our next increment of composite is because the dentin bond strength hasn't fully developed. So by waiting 5 minutes, we allow this dentin bond strength to mature. Is that right?
Yeah, correct. So what happens if we didn't do like how to say? Just imagine this is your bonding agent, this is your dentin tubules. So once you cure it, you wait for 5 minutes. What happens if you place your composite on top? If you can go 1 mm, so that you want like how to say composite to shrink to most bondable surface. If you place about like 2 mm like that, so it's a huge amount. So your composite, if you don't have any like bonded surface to shrink, it just shrink to the center of the mass. So what happens? It pulls away your how to say hybrid layer towards the shrinkage, and it creates a space, that space between your composite and your dentin. So every time patient chews, there'll be hydrodynamic fluid therapy. Theory, right? The water will be like how to say irritating.
Yeah, it'll be irritating between that space.
Yeah. Right. So be shooting. So that's why patient come back to you with a complaint that whenever I chew, doctor, I feel sensitivity. So for you, we're using a rubber dam and doing a composite restoration. For patient to feel sensitivity on the clamp tooth is quite normal. Within 2 to 3 days, you go off. But if patient comes back with sensitivity on the feeling tooth, then high chances you have to open back and redo back your feeling. So that's why, like how to say, in biomimetic, we term them as a bottom to top approach. So every layer is very important. And how to say, very good anatomy is just like a cherry on top of the cake. So if the cherry is nice and cake is not nice, people will say, what lousy cake shop. So something similar here.
Right.
And that, how to say, patient really doesn't really care, like how to say, wow, you did my molar tooth very nicely. Very less patient who appreciate. Patient really appreciate on the function.
Yeah, I'd be crazy not to appreciate your work, Dr. Navin. Your carving is just amazing.
That's just for self-satisfaction, but still, older patient, I don't carve much. I just make the slope nicely so that they can function easily.
Okay. Just to clarify, adding the flower adhesive on top of the bonding layer, that is also included within that 5 minutes of decoupling, correct?
Okay. So 5 minutes of decoupling time, what can you do? So you can, how to say, resin coat, and you can, how to say, do proximal build-up alone without touching your, if it's a class 2, without touching your dentin, you just do build-up. So you can do like, how to say, incremental, like how to say, if this is the wall, your class 2 wall, just place it here, then place it here. So you are basically you're playing with your C factor, you're lowering your C factor. So there'll be lesser polymerization shrinkage stress there. So by doing all these things, how to say resin coating, proximal build-up, ribbon placing, you are easily be 5 minutes there.
Right. So, if you don't mind just debunking one of this myth. So, whenever you talked about whenever you cure that next composite too early without waiting for 5 minutes, you don't allow the bond to decouple. So, every time after you finish your composite, let's say class 2, and you take that PA, you'll see that one little line between that composite and your dentin. Is that tear from the bonding? Is that gap caused by from the tear from bonding?
It always depends on what type of bonding agent you're using, and secondly, like how to say, how thick bonding agent you apply also plays a role.
Okay.
Because not all bonding agent are radiolucent and not all are radio opaque. So you have to take that into consideration as well.
Right. Okay. Thank you so much for answering, Dr. Navin. Do you have anything to add on? Otherwise, I'll just take over for 1
I think
minute.
you can take over. Then thank you very much, everyone. If in case you guys got any question to ask or what, feel free to DM me. So I surely will answer you guys. Thank you very much.
Right. Thank you so much again, Dr. Navin, for answering my questions and doing this webinar for us. Okay, just before we jump into Q&A, is just that we have just a little bit amount of time left, so we will be picking the questions out. For the questions which have not been answered, we will compile them into a list. I will personally ask Dr. Caitlin and Dr. Navin, and then we will repost those questions and answer them on Gen D's story, if that's okay with you guys. All right, and just if you guys don't mind, just stay back at the end of the webinar for maybe an